So, Linda, thank you for joining me for this, I think, exceptionally important conversation, which I've been so excited to have with you. And you'll talk a little bit about your background. As far as I know, that you're a exceptionally experienced nurse. I think you've got 4 decades in the field with a special interest in oncology and palliative care,
Yeah.
both in the UK and around the world. I know that that's your special interest and passion, and that's how one of the ways we've connected. When we had a mutual friend who was dying, and were in contact around the support you were giving to the family, both to her and to the family, as she was dying. And I realized at the time how important this piece of the puzzle is, and how it affects also the entire grief story. Because
Yes.
when someone's dying, even when someone becomes ill, but now we're focusing on when they're dying, there's a grieving that's already started. And I really, really have come to appreciate that, and saw that post this friend passing, when my father passed away and my sister passed away. And so I wanted to kind of talk to you in this conversation and see what all the kind of pieces are around how we support someone who's dying and their surrounding family. And so I guess, is there anything else you want to add that I didn't add in terms of your background or experience in this area? Or did I cover it?
I think you've covered it. I think anything that I've learned from my trip, my patients and their families. It's a work where you've only got one chance of getting it right.
Why do you say that? Like, why do you say one chance? Because you say they're not gonna die again. Is that what you mean by one
Exactly.
chance?
It's like I compare it to the opposite of a delivery.
Yeah,
And
yeah,
again, you've only got one chance.
yeah.
And it's a privilege. It's a
Or
real privilege
yeah.
to be with somebody on that journey.
Well, it's funny you say that, because I felt like with my sister, I was there when she passed away, and I felt it was a privilege. And I've heard a lot of other people say that when there's not too much trauma surrounding it, and confusion and conflict and fractiousness, people can actually appreciate what a privilege it is, when you're part of the family
And
or you're a loved one.
I think in our culture, perhaps we don't want to talk about it, but as my late father would say, since I was a little girl, the surest thing in life after birth is death.
Uh-huh.
And we're dying. We're all moving on. It's every day, every second that goes on. And I think in cultures that recognize it, not that all the time we should be thinking morbid thoughts, but in those cultures and religions that realize that we're here to grow, but one day we will be moving on. And I think years ago, death was part of the family. The elderly grandmother would be dying in her chair with the grandchild or great-grandchild playing on the floor in the kitchen.
No.
Just like in the other room, the daughter or daughter-in-law would be giving birth. And I think as we've professionalized and institutionalized, I think there's a lot of advantages to modern medicine and palliative care medicine, especially. It's made it sometimes very sterile, and it's something we don't talk about or hand it over to other people. And I think it's time that it comes back, that it's a partnership between the family and the professionals.
That's beautiful. And what I guess that leads into is my first experience with someone in my family dying. My father, about a year and a half ago, was that with like it's called hospice in South Africa, was that he did not want to entertain it. When we brought it up, he was like not having it. My mother too, and my father was not at the end. He didn't want to face the fact that he was dying until he died. He wouldn't speak about it. But my mother was very conscious he was dying. But even for her, she was like, no, we're not having them in the house. And why do you think there is such a stigma? Does that come from just a fear of death?
It's very interesting because I think palliative care, people see it as the last day, the last 2 days. And when I either volunteer or work as a palliative care nurse, the research shows that earlier that we get involved with people, the longer it can help. The research shows that it could actually help extend life. And actually, when I worked in metastatic breast cancer and I needed the support of the hospice or the hospice community team, I would tell them that they're specialized in symptom relief. Use them, and please God, you may not need them for a long time. And I think it depends how we sell it. And when I used to meet a patient and their family that had been referred to us, I would, if they were religious, I would say to them, let's pray, you can pray for the best, but let's prepare for the worst. Or let's hope for the best, prepare for the worst, and please God, you won't need us. But I can't change the diagnosis or prognosis, but I can help it not be that emergency, that time and energy wasted on things when the clock is ticking. And sometimes, because I'm an outsider but get to know the family and the patient, we can take away those extra things that really sometimes can cause such pain. We can control the external. But I think the hospices, I think they still have that old-fashioned connotation where literally you're given a whole load of morphine and you sort of died. And now people, what I like to do is, if we can't control a patient's pain, they go in for respite for a couple of days and come out. So that they actually know that they're not always going in, because I can't begin to imagine what it's like to go into somewhere knowing you're not coming out again. Yes. And therefore we try and avoid that. And I had one young lady, she was about 40 and she was single, and her biggest fear was to be dying alone in her flat. And so what we arranged over that year is that she went in for respite care. And that we could still follow her rules when she went in the last time, that there was still a chance that she would go back to her flat.
Yes. And of course there's a distinction though between because in my experience of hospice, especially with my sister who passed away 8 months ago, was in the home. So that was because we had private medical care, and so she had hospice at home. But you can have hospice in your home. Many people do, right?
Very much. And it's actually the best of both worlds. If the family can cope.
Yes.
I think it's, look, people used to give birth at home. For them, a lot of
babies. They still do. Yes. I know many people who do. Yeah.
It's not always safe. It's not always the best for the mother and the baby. It may be the most romantic and beautiful. But I think it saves people dying. And I think if we prepare and talk about it early enough and take the most important people's feelings and views in consideration, it can be done beautifully at home.
Yes. And I do want to speak about that. I want to talk about taking the dying person's needs into account. But I first wanted to just ask you a question. Are you saying, because my understanding almost was that palliative care kicks in when treatment stops, that there's almost like we're in a treatment, but it sounded like you were saying that doesn't need to be the case.
No. So the research shows that sometimes you call it a pain control team, but if the palliative care team gets involved early enough, first of all, it builds up relationships. And if, one nurse or doctor doesn't click in, we can offer occupational therapy, physiotherapy. We can help in those painful conversations where there's time to sort of test the waters. There's counselling, there's Reiki, there's massage, all the things that we can offer. And it's helping them sort of navigate. And some of our patients here have these bucket wishes. Wish, we can help them with that. But really, if we don't control somebody's pain, and that doesn't always mean physical pain, it could be emotional pain. If they're nauseous or they don't have appetite, the palliative care team are the most specialist in that. By helping somebody not have pain, then they're going to eat a bit more. By eating a bit more, they're not going to lose weight. They're not so much at risk of infection. They may be able to have another treatment. So actually, when the palliative care team and the acute And it's not always about cancer. There's lots of other illnesses that become palliative. If we can step in and help, often it extends and makes it a much more comfortable, peaceful journey.
So
And
then
we can step in and step out.
So then I've got another question for you again, because I think these are some of the misconceptions, and so I just want to get clear about them. So, but does it need to be that it's terminal in order for palliative because to kick in? Is that where the difference is? It's not just somebody going through
I think
treatment that hopefully they'll go
no.
into remission.
So I think nowadays a lot of cancers are, thank God, treatable and curable. But I think when it starts to metastasize, when it's spread, so for a breast cancer to spread even to one place, it's already metastatic. And how we like to say, or what we really believe, is that it is, most of the time, it is not curable, but we are going to keep treating it. We are
Yes.
going to try and keep a lid on that pressure cooker and give you as much extended life as possible. Now, if perhaps during that treatment, we know, unless there's an open miracle, it could be 6 months, could be a year, it could be 2 years. But then nowadays with modern, I've seen it in my own lifetime, research, there are second and third and fourth line treatments. Metastatic breast cancer that, say, 15, 20 years ago, people died within a couple of years. Now getting to 4 or 5 years now, that's not a very long time when you're in your 30s, 40s, 50s, 60s, but compared to 3 months to 6 months, so these treatments, if we can support that patient with their pain, with their nausea, with their lack of appetite, with their emotional pain,
Yes.
if we can take that energy, let them have a good life and concentrate on their treatments, then so we can dip in and out. So we're not.
I hear that. You don't have to, because I've been on a forum where I was on a lot of different cancer forums, and my sister had triple negative cancer, which was one of the most aggressive. There were people who had metastasized to various different organs and who 20 years later were still on the forum. And there were a lot of different stories around the world like that, but there were various stages. They were having the most intense treatment, at times, and then
Yes.
they come out and be clear for 5 years, etc. And
Yes.
so you're saying that you can support during those times.
Yes. So then when not needed,
Yeah.
Yeah.
Then you can step out. Okay, so that's really, really good to know. And again, it's important because it reduces the stigma of, if hospice are coming in, which sometimes is the case, but then it means this, as you say, death is imminent. It doesn't have to be like that, and that's not.
I think the hardest is often when we get called at the last moment.
Yeah.
Now, if somebody's been managing very well and they become unfortunately unconscious, or they're in pain, or we can deal with it, that's okay. But often it's better when we've had a long relationship with them. We work together with a family doctor, we could work together in the hospital. So the earlier we get in, even if we meet them, give them information, and then they don't contact us for months and months, they know who we are, we're there. Every so often we'll just do a phone call. How's it doing? You don't need us? That's great.
Yes, I hear that. I hear that. Sometimes I know, like in my sister's case, it just doesn't work out that way because from her diagnosis, she did have cancer, but she was, kind of cancer-free and doing well, very under control. And she was, working and, she wasn't in pain. She wasn't having treatment at that stage. And then she got this diagnosis and 10 days later she was gone. It was a very quick and rapid and very painful deterioration. But hospice even stepping in there, which she was very, very open to palliative care hospice. She was very wanted to face her death in the right way, do it right, and so but it was just, unfortunately, it was that very kind of quick, sudden coming into our lives, but made a massive difference, which maybe we'll talk about anyhow.
Yes.
Yeah. So a question I wanted to ask you: the person who's dying, and say now it is imminent, the person is dying in those, and you come in, kind of in the end stages, the last few weeks or what is it that you offer if we first focus on the actual person who's dying, themselves? What does palliative care offer them?
So I think it's support physically and emotionally.
Uh-huh.
It's sometimes, or often, being the advocate.
What does
Sometimes,
that mean, being the advocate? Just speak a bit more.
sometimes the things they don't want to say, or things they want that they perhaps don't want to upset the families.
Yes.
Perhaps, communication. Families don't start having problems with each other because somebody's ill or dying. Often
There's
there's
a
this
there's
little
a dynamic
there's
already in place.
dynamic.
Yeah.
Yeah. And even if the dynamics were great, there's always been a tiny crack. And
Uh-huh.
now there's a big crack. It's the dynamics between a husband and wife. Perhaps the husband has always protected the wife, not letting her know they're a bit overdrawn in the bank, perhaps, whatever. Then there may be a time that he wants to protect her, or vice versa.
Uh-huh.
It
Uh-huh.
may be that the ill patient doesn't want to start at home, or wants to start at home, but the relative just can't cope with that thought.
Uh-huh.
There's a lot, and we can explore this if you would like, that having somebody die in the house, in the lounge or in the bedroom,
Right.
it's got memories, they're still there, but can you ever be happy in that room again? Will you ever see it as a lounge or a bedroom again?
Right.
So sometimes, or the I had one case, a young girl, she was in her 30s, living at home, still a single girl. And the family and the community, she was going to get better. They were trying every sort of concoction. And she was a stage 4. And I used to go in every day just to give an injection. It was voluntary, it wasn't through my work. And we built up a really good relationship. And we were positive, and we used to joke and etc. that I should find her a husband. And she, one day, suddenly on a Sunday morning, said to me, "Have you ever been with somebody when they die?"
Uh-huh.
And I said, "Yes." I said, "Why are you asking? What is it, sweetheart?" She goes, "I just want to know what it's like when you die." So
Uh-huh.
we explored it. And she said she knows, she's dying, but she doesn't, her family don't want to talk about it. And we
Uh-huh.
spoke for a long time. And I wasn't popular with the family.
Yes.
I felt I had to be honest with her. She
Yes.
was happy to go along with everybody's beautiful, I don't want to call them lies, because they had hope, they
Uh-huh.
had belief, but it
Uh-huh.
was in their face. And I felt at least I gave her that safe time. And I think she was much calmer and went along with that till
Uh,
the end.
uh,
Had that time and her own thoughts.
to
I remember,
process that.
I remember her saying that she used to lie in bed wondering and thinking. And so we explored it. And I
Yes.
think telling her that I wasn't frightened of death, that when you're surrounded by people you love and people that can help you, it's not frightening. It's sad. It's very sad for the families. It's
Yes.
sad for you, what you're going to miss, but don't be scared. And I think I could see it was a few weeks before she died, and it gave her that strength she was supporting her family.
Yeah. Yeah.
And therefore, I had to be there to support her,
To
because I
support
was
her.
not, I got told off.
Yeah. I could imagine that. And so 2 examples that come to mind, 2 very different examples. And of course, I'm speaking from my own experience, which on one hand, I want to say is limited, but on the other hand, doesn't feel
No, it's
limited.
not.
Losing my father and
Terry, you're being
sister.
honest.
Yeah. No, I'm just saying, but of losing people, because I haven't had like you many. But so what was interesting when you saying being an advocate for the person who's dying, to me, why that's so important is, and I want to give 2 very different examples. When my father was dying, he was very adamant, and he was a very strong man, and he was a leader, and he had led big organizations in his life, and he had led this family, and his will was what happened.
Right.
And he was very adamant in his journey how that he wanted to be treated till the very end. It wasn't for him. He was prepared to sacrifice quality of life to keep himself alive, and that upset the people, me and my sister, because we wanted him to. We could see how much he was suffering, and we could see the end was inevitable, and we just felt he is so unhappy psychologically and physically in all ways. We could see both of those. It wasn't that we were making that up. He was really suffering.
Right.
And even when it was imminent that he was going to die, you could see it was a few weeks. We had a full-time carer there. He had a drain. The oncologist had told us he still wanted the new medication, and I remember when his oncologist was on a Zoom call, we were all there. This was about a week before he died. His oncologist told him we couldn't get that medication in South Africa. He said to him, well, what do you want me to do? Die? And like we were sitting there, we almost like giggled because we were like, yes, like that is what's happening. But one of the things is that at first we were upset about it, and we were trying to not fight him in a terrible way, because we were trying to, in a sensitive way, encourage him to step back and to let go of this medication, which wasn't working anymore. The oncologist said that, but the oncologist was supporting him. And so we went to speak to him, and he kind of said to us, like, your father he's a man of dignity, and he wants to do this his way. Right. And what really hit me in that conversation, I got a deep insight. I realized that a human has the free will to on how we want to live and how we want to die. And I wasn't respecting my father's. Of course, you can offer him your 2 cents, etc. But there was he lived in his way, and he was going to die in his way. And as soon as I realized that, I could step back and I could allow him that, not that he wasn't going to get that, but I could give up that kind of fight that I had. And I just wanted to contrast it with my sister when she was in hospital and we were still giving her treatment. This was, I'd say, 48 hours before she died. We were still giving her treatment, and that's because the diagnosis came very quickly, and this diagnosis is a very short one. So we knew there was like 3 to 6 months, but it's unusual that it would be 10 days. Yeah. And because she was very young, the doctors and she had young kids, the doctors felt that if they could, she had something called leptomeningeal, where the cancer goes into the kind of, what do you call it, the brainstem, and the meninges goes down. Yeah, and it's all through the neurological system,
nervous system. Right?
Yeah, the nervous system. And so they felt though that she had a tumor in her brain, that if they could make it smaller, they could give her quality of life, get her home, and she could be around her family for 3 months. Right. But it wasn't working. The treatment was hurting her so badly. She was in so much pain, and she was getting sick and sicker. She was essentially dying, we could see. It just wasn't working. And she wanted to go home. She kept saying throughout this week, I want to go home, I want to go home. But the doctors were like, we can't give you this treatment as an outpatient. You're too sick. And eventually this malach, this angel, came in, who was a doctor on a very high level and also an extremely spiritual person, extremely intuitive. And I remember he came in Erev Shabbos, and he went to see my sister, and he came out and he said, Terry, we need to honor your sister's wishes. And as soon as he said that, I said, she wants to go home. And what was interesting is that we decided to bring her home, stop the treatment, and her children arrived to say good Shabbos. And when they heard she was going home, they were finished. They started to cry and scream, and she was very ill at this time, half conscious, and she was like, we got them out the room, and she said to me, why are they screaming? And I said, because they don't want you to go home. And she said, do they think that I'm going home to die? And I said, yes. And she said, am I going home to die? And I said, yes. And she said, Ter, I can't do it anymore. I can't. I'm sorry. And I said, I know, and it's fine. She couldn't fight it anymore. She was in too much pain. My husband always says, how did you say that? Like, how come you were so honest? But it's because, yeah. And I think it's because I was so present with her that week, and we were facing it. We had made this pact for many years when she first got cancer, that we were not going to put our heads under. We were going to face this and face death and be honest with each other in this journey. And I always was along the way. Every time she got another symptom and said, is this bad? I wouldn't say, no, it's fine. We would say, yeah, this is not good, but it means this, and we'd face things. Anyhow, and so it was such a important moment in her journey, as you're saying, because she needed that next step, and she needed to face her death, because 48 hours later she was gone, So then at least she came home and had that 48 hours that we could really prepare. And what was amazing, Linda, was to see the kids transition because of hospice. Because hospice came in, and they were at the end telling her that she could go, that they were giving her permission to go. And they got there so fast because of the help of hospice, the hospice nurse we had.
And a point that came into my mind, first of all, my respect to you goes up even further, that you should be palliative care nurse, Terry, is that often one of the things that palliative team do, and that could be the doctors or the nurses, is that often the acute, that means the treating doctors, especially in oncology, they are trained and they've gone into it to cure people.
Okay.
And that could be the surgeons as well. And they haven't had the education, the support, the counselling to actually let go of their patients and let them go on their next journey.
Yes.
And often by that, you can actually make the patient's journey harder. We've had hematologists, oncologists wanting to do all sorts of treatments the day before, patients dying. And we've had to support the oncologists to let go. Often the family or the patient has understood quicker than the doctors.
Yeah. By the way, we were very lucky, because we had this person who I said came in who was a senior doctor as well as a very spiritual person. And we also had, my sister was close to the head of oncology, breast surgeon, who came up. They were very close. She wrote articles for this breast surgeon's cancer journal. And she came up when she heard that she was really bad. She saw her, and she straight away said, "We've got to get her home. Like, she's dying. Like, stop this nonsense." Like, she was a very straight person. And so they were the opposite of what you're describing, which was so helpful, because
there's no bad maliciousness from the acute doctors. They're just not trained. And most of the time, people need treating.
Yes.
It's a different type of treating. And therefore, when we go on that journey with, when they're having the treatment, when somebody's metastatic, we can actually discuss with the doctors not to promise the world sometimes. Just before an appointment, sometimes we'll have a meeting, when they offer a treatment that really hasn't got too much hope, the pros and cons. And then we will support that patient and the doctors to either take it, not take it. If they take it, they can stop it. If they don't take it now, they can try it perhaps in a week or two. But I think most doctors are there to save lives at all costs.
Yes.
And they sometimes, if there's an ego involved, they see it as a failure. Sometimes they just can't cope with dying.
Yeah. And what's interesting, by the way, and it's a conversation that I'm actually going to be having with Rabbi Tatz, and he's actually just published a paper to help. It's published now in a medical journal, which is going to be on this website, Finding Light Through Loss, for doctors to help them know the halachic remits of when somebody is dying, which I guess is going to be extremely, extremely helpful, so that the family don't feel that there's tension and fighting, etc. And it feels like there's, they have that knowledge.
Much needed. And there's a fine line between supporting the family, what's helping the patients, and what is sometimes a bit cosmetic. And what do I say by that? Halakhically, fluids may be contraindicated, and they may not do any good. If they're not going to do any harm, if you put a subcut, which means just a fine needle into a skin where they're getting a drop every few minutes. If that supports, if the patient wants that, great. And if that helps the family feel, because we all want to feed and give drinks and do, and the thought of somebody not drinking for a couple of days before they died or eating, so it would be very good, because halakhically, we've been waiting for this paper.
Yeah.
Good news.
I'll send it to you. So I guess my next question is the family. And it's complicated with the family because relationships are complicated. So everybody's going through their thing. There's the
That's right.
regrets, the things you want to say, the things you can't say, you're not sure. There's so many different, everyone's going through their own personal. How do you coming in? Because I'm sure one of the first things you've got to do is get a bead on the family dynamics. And then I saw when the hospice person came into to my sister's home, and again, it was very, very quick and sudden. One of the things she did was she like spoke to each of the children, and then she spoke about with us all together, and she just got a sense of the lay of the land in terms of what
Yes.
they would need to go through these kind of final days, or she thought at that time would be weeks with their.
Yeah. Um, Somehow you get a sense, I do pray for that I should not hurt anybody and I should say the right things. And sometimes it just comes out, you get a feel.
Uh-huh.
Um, and that's why I don't like to do these things by phone, not
Yes.
even by Zoom or video call. You go in, you feel, you can see. You
Yeah.
can see people say one thing, their faces are saying another. You can see emotional pain. It's very interesting. Often the person that doesn't say very much has the most to say, is
Yes.
perhaps suffering the most.
Yes.
You get a feeling for if people are thinking about the patient, are they thinking about themselves?
Yes. Yes.
And we can't fix things, we can't always fix things. I think sometimes just talking about it is enough, and perhaps sending them to the right places. We can't fix everything.
So how do you encourage people? Because I know that's part of what you've done. You've told me examples of it, to have the kind of conversations that are going to give them a resolution that people are thinking, I can't have those now. Like, what are the kinds of things that you do encourage people to talk about with their loved one before they die?
Do you mean sort of weeks before or the day before?
I mean, in the days, the week, I mean, because you often don't know exactly. I remember with my sister, they'd said, this could be a few weeks, but it wasn't. It was 2 days, but that was on the table too. So you know that you need to start to have conversations if you're going to have those, and if they're appropriate, I'm saying. But
I think I feel guided by the patient themselves.
yes,
One of the things I'll always say is never say anything in front of the patient if they're semi-conscious, or outside the door when they're not well,
such a
that you
good
wouldn't
point.
want that person to hear.
Yeah.
So if we're going to have a conversation that's something completely the opposite of what the patient wants, let's have it downstairs. But let's be open and honest if we can. I find that most of the time, openness and honesty helps.
Yes.
I think we're guided by the game. I don't like to call it a game and to make it superficial, but how the patient is leading it, either consciously or subconsciously, and we take their cues.
So that's really interesting that you say that, because like I had in my mind a whole bunch of things I was going to talk to and rectify, with my father, who I had a good relationship with, but there was a lot of unsaid things.
Of
And every
course,
time I approached him, and this was before, because thank God, he had a peaceful death. He went to bed and he died. He was ill at that stage, but he was still getting up and in a wheelchair and doing his Lego and the things that he did each day. But we knew he was dying. And so when I came out in those weeks before to visit him, I was determined to try and just emotionally connect in the way I wanted to and say some of the things. But I could sense that every time I did that, a wall went up. And then I had to make peace with that. That's not what he wants. And I couldn't force that on him. That was also part of my kind of acceptance. So you saying you should be led by the patient is
led by
interesting.
the patient, and sometimes I think really none of us really believe that we're going to die.
Yeah.
And I think also perhaps things that were important are not important anymore.
Yes.
You know, that perhaps 10 years ago you had an argument about such and such, or you didn't buy me whatever, or whatever it was. Really, when somebody's got minutes and hours and days, there's a connection. Sometimes things don't always need to be said.
Do you have an example, though, of when something was said that you encouraged people to talk, and it did provide, it was very helpful that they actually did speak.
Nothing that comes to mind at the moment, but perhaps
Something,
I'll bear that one in mind.
yes.
Um,
One of the things, just to say, that the hospice nurse did that was really interesting to me was, first of all, she really, really encouraged the kids to be in the room.
yeah.
Not to be in the room in a very raucous, loud way, because my sister was suffering a lot and they were struggling to get the pain under control, and they wanted the room calm. But to each one go in and just lie next to her and cuddle
Yes.
her and be with her. They
Lovely.
really encouraged them, where a lot of people would say, even the 8-year-old, don't be around death, protect the kids. She was very much into having them in the room. And then when my sister started to go unconscious, and that was also as a result of the morphine as well, trying to get her comfortable, both together, they got the family to sit in the room and to have a conversation. And they had a conversation, about a 3-hour conversation. And I stepped out for this, and I heard there was laughter, there was crying, and it was one way, but you could see my sister could sense what was going on then, because of her responses, her bodily responses, her grunts. And they said everything. They said everything they loved, everything they regretted, memories they had, what they wished, how they wished in certain circumstances they hadn't given her like a hard time as teenagers. And everything was said in that room for 3 hours. And I know it was incredibly, incredibly cathartic and comforting for this family to have done that. And again, this hospice nurse, she engendered, that would never have happened, that conversation, without her. So that
Wow.
to me was incredibly healing.
Wow. It's just going through my head now that you would think, with all my experiences, that I'd be preparing for this every day, that perhaps more than most people, I know that, God forbid, this is going to happen to all of us.
Yes.
And yet we don't.
Yeah.
My late father used to say, don't go to bed on an argument.
Uh-huh.
But we do.
Yes.
So, there is this thing that I think, yes, however much I know death is the most surest thing,
Yes.
and I think people prioritize, and I think some things are better unsaid. Some people have said, I think it's perfect what went on with your sister. It's, and perhaps later I'll talk about my dad's perfect death, apart from the fact that he passed away. I think the important things are said, and lots of hand holding. And I think years ago, before my time, kids wouldn't even be told that somebody's ill, dying. Somebody would just, they wouldn't be able to even go to the funeral. So there was often no closure. This helps with the closure. It's painful.
Yeah.
Yes, they may have been laughing, but it's very painful what they went through, and comforting at the same time. That sounds like a position, but I think each is an individual. Each case is so individual, and what works for one just doesn't work for the other.
Yeah, I definitely hear that. The one thing that really struck me, especially with my sister dying, and by the way, on the day before she died, which was Shabbos, she got a bit lucid and she called in most of her kids, the older ones, and had final conversations with them, which was so precious to them. Yeah. And then she called me in, and she wanted to talk to me about dying. It was the first time she said to me, she said, Tam, I'm scared of dying. I'm scared. And she said, I don't know how to do it. I've never done it before. My sister was someone who did everything really well. She was such a confident person, and she was like, I've never done it before. What's gonna happen? So I first described to her the physical journey, because the hospice nurse had been describing that to us. And then as best as I could, I described what I felt, because I've never also done it before, the spiritual journey, and how, as your body, you could see her body dying, as it broke down. I said, your neshoma is more and more vibrant, and your neshoma is not dying. So it knows how to transition, because it's eternal. So it will guide you. This process will be organic. I said, you don't need to know how to do it, because there's a part of you, that eternal part of you, that knows how to make this transition. And so it will lead you. So you can just relax and you don't have to worry about that, And, and it was a very special conversation to have. And I'm so glad that we did have it, because part of what I could see was happening in the room because of the support we had and having people who didn't fear death in the room.
Right.
Was you could see something special was happening. You could see that there was a transition happening when you step back from the fact of this kind of tragedy of this person I loved most in the world and wanted to protect my little sister and her kids and her family and all of that, and being so young and so sudden. You could see that there was this beautiful transition that was happening that was perfect, because it wouldn't happen if it wasn't perfect, You could see God's perfect, and there was something spiritually happening. And I think that, by the way, having the right people in the room, the support of hospice and people who knew how to do this transition, who knew about this transition, was incredibly helpful for the family, because, as you say, Linda, doesn't take away the pain, but it does bring a comfort at the same time, and you can feel both,
I think, Terry, we're blessed if we have a faith.
Yes.
I'm sure the people that are watching this may not all have a religion or a faith.
Well, this is for the Jewish community, the site. Whether, and what's interesting though is whether a person is religious or not religious, there are many people I've spoken to who aren't overtly practicing, say, Orthodox or mitzvahs, but they're incredibly spiritual. And then there's some people who aren't, and that's, so they're both. But even if you're not practicing, I've seen people who are incredibly the whole process spiritual. Yeah.
But I think when we do have faith and we know that this world, this world is a bridge. It's a road to a better place, and I think one feels at almost about 2 weeks before somebody passes away, before somebody's nifta, before somebody dies, you feel an added holiness, an added spirituality. And even my non-Jewish colleagues, my colleagues that don't believe in anything, there is. And if you let yourself feel it.
Are you saying it's surrounding the person?
Surrounding the person, and often a week or 2 weeks before, sometimes a couple of days, but it can be a week or two before, they'll call out names of people that died.
Yes.
They will have periods where they're just looking up and saying names, and then coming back in or saying, did so-and-so visit when that person died 20, 30 years ago?
Yeah.
And there's an aura.
Yes.
And sometimes I find that however much that patient, if they're with it, if, the morphine or the pain or the illness hasn't completely taken over, they will talk to you about the mundane. But they're half with us.
Mm-hmm.
They've half got a leg in the next world. And you know what? They're quite happy and peaceful about it.
Yes.
It's us. We're left. We're wanting them to stay. And we're actually sometimes pulling them backwards to us. And they're going towards that journey.
And how do you help someone who's not peaceful with it? Sometimes it can happen very suddenly. And again, sometimes they're very young or not. And they're not. How do you help that person who's dying find more acceptance as a person who's called in,
I completely acknowledge with them how hard, how unfair, how sad.
Mm-hmm.
Let them.
Mm-hmm.
But tell them they're safe. Tell them they're loved. God loves them. That all of us are on a journey. And sometimes we don't realize we've finished our job in this world. And actually, I can't scientifically prove it, but the privilege that I've had, I've been with younger people at NIFTA, looking back on their lives, you realize they've done it fast.
They've packed a lot into that time, be
it religiously or socially or what they've done. I mean, the case that you and me, our young friends, those about 25, 26 years ago. So I knew her for about a couple of years before she died, and we both had sons in the same class. in school. And we knew when they went to kindergarten that the following year they would be staying till 5 o'clock, which is pretty young when a kid's like 5 years old. But we all had a second child or third child after, and we couldn't wait for that extended time because our first one. And she didn't want it. Before she was ill, she used to come at lunchtime and park outside, not let him know, but look through the bushes.
Yes.
And watch him.
Beautiful.
And it was as if she had to do things, and she did so much in her short life that some of us at the age of 50, 60 and 70 haven't done. I know it sounds twee, but it's a privilege. A lot of these people, and especially in the last few weeks of their lives, their spirituality it's like they've always been preparing for it. It's like a plane that's sort of, and suddenly whoosh. Yeah. And it's a privilege to be in their presence. And in fact, this same young lady, I remember you would think she was so normal. She was always a bit plump. We were always talking about diets, and we were always doing exercise. And then a couple of weeks before she passed away, I'd been called as an urgent to her house, and I was wearing my Shabbat clothes, and the non-Jewish nurse said to me, "Oh, Linda, you look really nice." And of course, idiot here said, "Well, if my bottom wasn't so big in my skirts." And she said, and she was like 5.5, 6 stone at the time. She said to me, "Linda, we don't talk diets here anymore. It's not important." And I said, "Sweetheart, you're right. I'm sorry." Have I learned from that? Of course, I don't want to put weight on, but it helps balance. But we are human.
Yes.
And even though, I deal with death and dying a lot, we have to enjoy life, and we're not angels.
Yeah.
As my late father would say, so if it upset you, I don't know, your hair got cut too short, it's going to upset you for a couple of weeks, try it for a week. It was be a week, try. I'm still work in progress. But people that are dying are on a journey.
Yes.
They really are, and they leave us behind.
So you speak to them about that journey, and that's, and I heard this hospice nurse was speaking to my sister a lot and to her kids about that journey. And, and what I thought was beautiful in terms of the children was how she helped them to help their mother go on that journey. And, and just to see their ability to be able to do that when they'd been so resistant to that, so angry that she wasn't. You promised us you'd fight. Why are you not fighting? You can't come home. They wanted to give up the fight. And then to saying, as painful as it was, they would sob, but they would say, you need to let go, because they could see she was in so much pain, and they could see she was fighting to stay for them. And that's beautiful to help children with that, I just think it's priceless.
And the spouse, it could be older,
Spouse too.
I've seen, because it's so final.
Yes.
It's so final, but we also have the belief that the person's good deeds, their neshoma, their love, their legacies live on. And if we let that come into ourselves, that helps us. But our first thing is to support the person. By supporting the person and avoiding emergencies and keeping them comfortable and answering the questions.
Yes.
And telling them, sometimes you can see they're hanging on because they're just in the room, and just by whispering in their ear, Hashem is waiting for you, Hashem loves you, you're safe. You're safe. Go home. Go in peace.
Yeah.
You would think I would get used to it.
Yes.
The day you don't feel it is the day you don't be involved.
Yeah.
Okay. Yeah. It's still hard. It's that finality of death.
But you know what, Linda? I think if you're going to talk about just really immersing myself in this topic, for not only for the Finding Loss website, but finding life through loss, but also through my own journey, one of the things I've seen is that someone said this, who wrote this beautiful book, once somebody's going to contribute to the website, a book that I read shortly after I lost my sister. They said, the more real Olam Haba is to you, the easier it will be to move through this process. And he also speaks a lot about his book about the relationship you still have. And I feel the stronger the relationship is, like, I still have a very strong relationship to my sister. I'm doing things for her neshama, and she's doing things for me. She's influencing me in so many different ways that I'm saying yes to things I wouldn't. She's bringing to mind, and so she's influencing me. I'm influencing her to the degree I can, she's coming to me in dreams almost very frequently and teaching me things, telling me things. And so I feel there's this ongoing relationship. It's somebody I interviewed said to me they lost their child very, very suddenly, tragically. And they said to me, when I asked them for their bio, they said, I am a mother who's bringing up one neshama and 4 physical children. But she really does feel that. She
Wow.
really, really does. And the siblings
Wow.
do. He's still in the home, but just in a different form.
Wow.
And somehow we're so disconnected from that, we're so attached to this kind of physical world that it's hard for us to contemplate that. And I think if we can help ourselves and each other with that, I think then it will make the whole kind of grief, losing someone, not that you can bypass the grief process. You've got to go through it.
One mustn't feel guilty. One mustn't say, yes, they're all I'm about. I actually spoke to the late Rabbi Ashkenazi Zatzal, who I'd been involved in a young mother who, not during the pregnancy, hadn't realized that she had a very fast-growing tumor, gave birth to twins, had a 2-year-old, and within a few months had passed away. And my last job was to just tell the rabbi who had done the bris for this young lady who had gone on a journey in her last couple of weeks from, I don't call anybody not religious. I say perhaps they're not yet religious.
Okay.
She had taken on covering her hair and no television on Shabbos, which is
mega. In the last few weeks, you're saying?
Last few weeks. And she died. And I phoned him, and my intent was just to tell him the time of the Levaya. And it came out of my mouth. I said, when somebody dies, we say, Baruch Adonai Le'emes, that it's all for the truth, it's all for the good, Hashem knows. He said, so why are we crying? Why am I not saying yes? Why? And he said, we have been given, and I can't give it justice because he spoke to me for about half an hour, but he said, we've been given grief, we've been given mourning and tears because of the loss of the person, the loss of the potential that person could have carried on doing, for the widowers, for the children, for the grandparents. And yes, we should cry. And I'd like to say that the worst thing to say to somebody is, this is, when they're grieving in their week of grief, in their year of grief, it's not the time for us to say, that was good, that's wonderful, they won't be doing any more sins. They're in all that. No. That's I've heard it. There's so yes, and sometimes you will have very religious people. They will have those times where they're struggling. You can be, we ask Hashem, and Hashem had said no. That means we can be upset, but that means that we're recognizing our God's spoken.
Yeah,
and we will come out of it.
Yeah. I think, we've got, hopefully we'll have a lot of talks on the healing process. And part of that is allowing yourself to feel the pain, to grieve, to be angry, to, they say the healing for the pain is in the pain. You have to go through that process. To various degrees, we protect ourselves from that, but you want to make sure that you're doing enough of that so that you can go through this healing. And that loss can feel so all-encompassing, it just literally brings you to your knees. But at the same time, you're almost allowing yourself to feel the pain, as you say, in a really real way, because you're never going to see that person, and and all the other difficult things that leaves that in huge pain and loss and chasm, is also developing and working on our relationship to the neshama, to the spiritual world. Both can be done. They're not one or the other. Both can be done. They can fit together.
I think often the patient will be on that journey ahead of us.
Yes.
And they sort of jump between being scared and not scared. And you just somehow get that moment. I remember last year, a young man, it's all gone very, very quickly in a few months, young kids. And he was being brave and he was being very religious. And they'd managed to walk him across the hallway and they were all doing, it was Hanukkah, it was actually Hanukkah last year. So you just get this feeling. I looked at him, I said, "You're scared." Nodded. And it was these conversations happen when you're not planning them.
Yes.
And somehow Hashem, if you're doing it not for your own ego, puts the right words in your mouth. And if you let that person speak and you pick up, and we must have spoken about 6-7 minutes, and we never spoke about it again. But you could see he was parking things and just letting it.
Yes. And that came out. Before we end, one thing that I wanted to tell you, ask you what you think of this, that I learned through this about being with someone when they're dying, is I had this thing that I was the older sister and I wanted to protect my younger sister. So throughout this, I'd be the person she'd call around medical stuff and this. And as soon as we knew it was this diagnosis, she called me and said, "Taya, please, I need you, come out." And I always kind of had that role as the big sister to protect her. And that was one of the things that was difficult. It wasn't an existential crisis because I understood this is Hashem's world and I'm not the savior here. But there was a narrative in my mind that was, I couldn't protect her. I couldn't take the pain away. I couldn't stop this happening. And a couple of weeks ago, this is 8 months afterwards, I guess I was playing on my mind a little bit, some of that, it's some of those images of her in pain and me not being able to. And I had this dream where in the dream it was me dying and I was dying and trying to come to terms with my own death. And one of the things that was difficult is that the people who were closest to me, for whatever reasons, couldn't be in the room. They didn't want, it was too difficult for them to be with me. And I was feeling incredibly lonely. And I was coming to terms with my own death, but part of me wanted them to be there with me in the room. And I realized when I woke up, I felt like what came to me straight away when I woke up was, it was enough that you were there. You were by her side, you were there. That's all she needed. You were calm, you were holding her hand, you were there. You didn't move from that room much, unless it was to go sleep a little bit. And that's all she needed from you. And I think there's something about being in the room with the person, because you got to leave behind your fear of seeing someone in pain and the discomfort. Like none of that existed for me. I could sit there with her in pain and still be there. Hashem gifted me that. It didn't freak me out in any way that I needed to get out the room, or run. I think, and you don't need everybody to do that because, and people have different relationships. It's not everyone's role. For some people, it's not appropriate or it is too much and they do need to. But if there can be somebody that can sit there with the person, I feel like that's very comforting for the neshoma during that time. That's what I sense.
It is. Again, each death is individual. And sometimes in my 40 years, you've seen it quite a few times where the family and the loved ones are sitting and they're doing all the right things and it's calm and the person's is not in pain. They're just not dying. And people step out for whatever reason.
Yes. So I'm not talking about this when they're actually going, because we also had to step out for my sister to leave. She couldn't leave with us in the room, and that I've seen a lot over the years that they actually need you to go. But I'm talking more in the time leading up to that.
Time leading up, I think if people are calm and supportive, I think that person feels very, very safe.
Yes.
And it's a privilege. And again, sometimes I always support in the background.
Yes.
People can sing, people pray, people talk,
yes.
people sometimes just sit. And I've had the privilege a few times where literally the family around have just finished dabbling. And the person takes the last breath. And I'm not sure if it's appropriate now, but I didn't know there could be something as a perfect death. And if I could perhaps learn neshama from my father, who was Eliezer Ben Tzvi, he was a GP, a very respected GP, and he died 5 years ago. So he trained in the 50s, and cancer, the people died in pain, people didn't have the treatments now. And one of the things he always used to worry about was dying in pain. And of his own mortality. And he'd seen some horrible deaths, which thank God nowadays we try and avoid. We really try and we talk about it. He had a cancer over 10 years, and he was very grateful that in his day he would have been dead in 6 months. Now he had 10 extra years. And his last 10 days were actually spent in hospital. It was a privilege. He was in a private room on the 12th floor. And I was there to sleep in his room at night, the last few nights, and he wasn't in pain. And basically, the last couple of days, it was on Chol Hamoed Pesach. So, Erev first day, it was Erev Pesach. So the young grandchildren came, and he was still with it. He gave each one a message and a joke, because he always had a joke.
Yes.
The first day of Pesach, the older granddaughters came and sang Hallel, and he spoke to them. Second day of Pesach, somebody came on the ward, they wanted a minyan, and my dad, who was half conscious, half not conscious, and a very private man, they asked if he could be the 10th. They did it in his room, so he was a minyan man. We davened. The next day, first day Chol Hamoed, the whole family were around his bed. We davened, and I looked at my dad and I said to my brother, if you don't daven now and count Omer, you're not going to be able to. Davened. My brother's a Karliner, so he had a few extra words. As we all said Amen to Bracha, my father breathed out his last breath.
Wow. Beautiful.
Things that he'd asked for during the day, which normally the nurses wouldn't do because they'd be my students. He'd wanted certain things because he wanted the Chevra Kadisha for him to be in a better position for Chevra Kadisha. They agreed to. His bed was clean, it was spotless.
Yes.
It was, when he breathed the last, I almost wanted to say Maston. It was like a birth.
Yes. Yes.
Now, to show I'm human, and everybody else had never seen a death, so for them it was terrible. For me, in my 40 years, it was the most beautiful death, and nothing that he'd been scared of had happened.
Yes.
Nothing. But I want people to know, hearing this, and somebody who's used to death and dying, not that you ever get properly used to it. I crashed after the Shiva. I had not prepared myself. My whole mission had been that he should be comfortable, he should have dignity, he should die al pi halacha. Nothing should go wrong, and Baruch Hashem, it didn't.
Yes.
Forgotten to take into consideration
the loss for you
anymore.
Yeah.
So I want people to know that it's very multifaceted.
It's not going to stop you grieving. I think that's an important message, just because you have, even if whatever the death is, because often the death isn't as perfect as you said.
He was 89.
Yes.
I know that's not very old, but compared to my 30, 40, 50, 6-year-old patients and younger, and but it's a lot. So I think people should.
We're not going to, as I said, bypass grief. We're going to go through the grief, even if there's what you call the perfect death. And even if it's not, we're going to need to go through the grieving process. But I think hopefully this conversation is helpful for people in seeing that there's a way that we can help with that process. People like yourself and who are experts.
Perhaps it's a little bit too forward thinking, but we do something called advanced care planning. And now GPs are actually rolling that out sort of over 60-year-olds, sort of to start thinking about our own mortality like a will. Nobody wants to do a will. But if we start thinking, because we do know it's the surest thing in life, and then we can park that plan, let our loved ones know. There are certain people say, I never want to go into an old age home. Right? The families will do their best. Obviously, there are times when you have to override if it's not safe for the person to be in the house and they've got no capacity. But we try and respect. But if we have conversations about death, I'd never or time 20 we shouldn't. If we start in our own minds and then with our own families and friends talking about it, I think, Terry, you're doing a really important job, what you're doing to promote. That's just going to have to prepare for it. That will help with some of the pain and the preparedness for later on.
And another thing, like my sister had her kids as soon as she got ill with cancer, even though at the time the prognosis was a lot longer than we thought. She had them for the last few years with a therapist that she wanted them to have before and after, the right therapist for them. the right support for them, the right, and they were grief specialists. And so there are things that we can do. And that's because she wanted to not do it right. She wanted to make sure that the right support was around the family. And this is just an important piece of the puzzle. And I do want to say, as a caveat to this conversation, Linda, that each person also has to take into account the halachic decisions at each stage and be speaking to their rabbi. We were doing that with my father. Do we need to put him on, the day he actually died was the first day he couldn't eat. Do we need to feed him? And
Right.
there were a lot of different questions that we were asked in order to get an answer. It's not a one size fits
And
all.
people are always
So
scared. Yeah, people are scared of addiction to morphine, to the analgesic, but actually, if we're giving the pain relief for the right reasons for the person, people
yeah,
shouldn't have pain. Nowhere
yes,
to say people. And if we're giving it for the right reasons and it happens to hasten death, al
mm,
pilacha, that is allowed.
yeah,
I think people are
but
scared, but I think we need to prepare ourselves that death is the most surest thing in life. I'm not morbid. People that know me know that I have a great life, thank God, and I love to laugh around, and I'm not crying and sad all the time. I think we need, and I would need to work on myself as well, that if we start preparing, we're actually doing a sense of the kindness to ourselves and then with our families. But I think we need to sort of face.
the fact that, yes, my sister used to say to her kids, she used to say the death rate in families is 100%, And she had a marvelous sense of humor, by the way. One last anecdote I'll tell you, when just before she died, 2 days before she died, she, in contrast to what you were saying, that woman said to you about her body, we don't need to worry about how thin or fat. My sister kind of, I had to help with putting catheters and things in her body, and she was like, Ted, don't look, I'm not sneers. And I was like, yeah, but you're looking great. She'd lost so much weight because she couldn't eat, and she said, yeah, I finally get the perfect body. And, and she said, and can't even show it off in a bikini now, whatever. And it was just her, she had such a sense of humor, and it was right till the end, which was
And I
just
think,
wonderful.
like the back of our conversation at the beginning, hospices are usually happy places. People don't realize that there's
Yes.
lots of laughter.
Yes. As well,
And
there
they
can
both
be,
feel
yeah. And there was all of those, which was beautiful. It was whatever needed to come out, came out. And it was almost, it felt like a safe environment to do that. One that, yeah.
Yeah.
Well, Linda, thank you. And thank you for this conversation. As I said, it's one I've been looking so forward to, and for the work that you do, because it's so important. And anyhow, your details will be in the bio speaker notes if people want to contact you or ask you questions. Is that okay?
Of course, if I can be of any support, if I can take away one drop of people's pain, then I feel very, very privileged.
Beautiful. Thanks, Linda.
Thank you.